The next speaker is Dr. Afreen Bari, and after Dr. Afreen, it's Dr. Stuti Shah. So Dr. Afreen Bari's talk is, his paper is Inferior Crescent Sign in Pellucid Marginal Degeneration. Are you ready?
Yes, ma'am.
Please start the timer.
Good afternoon, everyone. I am Dr. Afreen Bari, and my topic is Inferior Crescent Sign in Pellucid Marginal Degeneration. There are no financial disclosures. Pellucid marginal degeneration is a non-inflammatory ectatic corneal disorder that usually presents bilaterally and appears between 2nd to 5th decade of life. It is typically diagnosed on slit lamp examination and on corneal topography. On slit lamp examination, it is characterized by a typical inferior band of corneal thinning, which is around 1 to 2 mm from the limbus, and it extends from around 4 to 8 o'clock hour with adjoining ectasia above it. Corneal topography typically depicts a crab claw or butterfly or kissing dove pattern, which is as seen here in the third image. Now in our study, it was an observational case series where we did OPD screening with torch at a tertiary eye care center over 6 months. We found 9 eyes which were suspects of pellucid marginal degeneration based on the torch test. Confirmatory examination was thereafter done using slit lamp and Scheimpflug imaging. What we did was we asked the patient to sit comfortably and gave him a distant target for fixation. Thereafter, pen light torch was shown from superior quadrant with a torch at around 45 degrees from the horizontal meridian in this position. What we could elicit in our cases was that a bright, sharp crescent illumination was observed in the inferior region of the cornea and iris just above the limbus. This was seen. Now the patients with positive signs were considered PMD suspects. 9 eyes had positive inferior crescent sign. PMD was observed in all the patients, which was then confirmed using corneal topography showing the typical crab claw pattern. This is one of the representative cases where we can see that on torchlight examination the typical inferior crescent was seen, and on topography it was confirmed that the patient was having a pellucid marginal degeneration. The topography showed a crab claw or kissing dove's pattern. This is one of the atypical case where the crescent was formed anteriorly, and the patient on slit lamp examination we saw that the patient had PMD with healed eye drops. Now coming to the topic, as one of the other disorder of the spectrum, keratoconus, it is also an ectatic disorder and it is characterized by paracentral corneal steepening with thinning classically involving the inferotemporal central region. One of the clinical signs that is used in the diagnosis is the Rizzuti sign, which is also elicited on simple torch lamp examination. As seen in the image, in Rizzuti's phenomena, a sharp focus of light rays on the nasal limbus and iris is appreciated in the conical pattern when we throw the beam of light temporally. In contrast to keratoconus, the area of thinning and ectasia and PMD usually involve the inferior cornea. So we propose that inferior crescent sign as observed in the patients is due to deflection of the incident rays with a shorter focal length at the inferior corneal area of steepening and adjacent iris, illuminating the iris part and giving the inferior crescent of light. However, a study with larger sample size needs to be conducted to study the relationship of the grade of PMD with the type of crescent formed. To conclude, our sign, the inferior crescent sign, is simple diagnostic sign for PMD which may be elicited in the outpatient department just with a torch without the need of additional equipments or even a slit lamp. And I would like to conclude by saying that in this era of continuous advancement of the technology, the simple clinical examination holds relevance. So this test will help us to screen cases of PMD. Thank you.
Afreen, have you looked at the false positivity and false negativity rates for this sign?
Ma'am, we did, after reviewing the literature, we did see that we might find false positive cases in cases of keratoconus, but however when we tried seeing in these cases we did not get such false positive, but we were expecting this to see, but we did not get. However, we need to conduct a larger study to find out.
Did you also check this sign with other corneal peripheral thinning disease such as Terrien's corneal degeneration? Terrien's corneal thinning degeneration?
Any signs?
Any signs of other peripheral corneal thinning disorders?
No, ma'am, we did not find such kind of clinical sign in literature described for other. Deciduous sign is a similar sign which has been previously historically described, but not with other ectatic disorders.
Okay, thank you.
Thank you.